Hello, and welcome to our webinar series showcasing the outstanding work of community agencies across New York State funded by the New York tax checkoff dollars to reduce mental health stigma. I'm David Minot, Executive Director of Mental Health News Education, publisher of Behavioral Health News and Autism Spectrum News. I'm honored to have the opportunity to highlight these impactful projects and share with you the details of this important stigma reduction work. This series of webinars aims to highlight the innovative efforts of 7 organizations funded by the New York State Office of Mental Health for Stigma Reduction Community Initiatives in 2022 and 2023. We'll learn how these agencies identified targeted audiences within their regions, tailored their engagement strategies, and chose their interventions to address specific types of stigma impacting their communities. Stigma remains a significant barrier, discouraging individuals from seeking mental health support and limiting opportunities for those experiencing these challenges. However, local community providers possess invaluable knowledge about the populations they serve, positioning them uniquely to develop the most effective anti-stigma interventions through tailored outreach, marketing, education, and contact-based efforts. Over the course of these 7 webinars, we'll dive deep into the real-world experiences of these agencies to explore their methodologies, the challenges they faced, and how they measured the impacts of their interventions. Their stories offer a wealth of insights for other organizations looking to implement successful stigma reduction initiatives in their communities. We will also examine the key elements essential to any stigma reduction project, including understanding the target audiences, defining engagement strategies, setting clear goals and deliverables, and developing mechanisms to evaluate both qualitative and quantitative outcomes. Ultimately, these webinars aim to stimulate broader interest and collaboration in the fight against mental health stigma and increase mental wellness across New York State and beyond. We will include contact information at the end and encourage you to reach out to today's speakers to discuss how you can replicate a similar project in your own community. By fostering community coalitions, we can amplify our collective efforts and drive meaningful change. Today, you'll be hearing from Melissa Clark, Vice President of Community Impact at the United Way of the Dutchess-Orange Region. Once again, thank you for joining us and enjoy today's presentation.
Thank you so much for the opportunity. It's great to be here today, and I really appreciate all the work that you all are doing. I'm going to tell you a little bit about our Stigma Reduction Project. I'm thrilled to be able to be a partner in this, and thanks again to all of the support from Office of Mental Health. We're tremendously appreciative for this opportunity, and thank you again for this opportunity to share. So just a little bit about my organization, United Way of the Dutchess-Orange Region. Our mission statement is that we fight for the health, education, financial stability of every person in our community. And I know you all are pretty familiar with the United Ways in your communities. We are unique in that we're each autonomous, so we all focus around health, education, financial stability, and what that looks like in our particular communities. For us, we focus around food access, after-school programs, and crisis intervention. We do a lot of diversity, equity, inclusion work, which I'll be going through in a moment. And of course, mental health is a really tremendous focus of ours as well. So again, a little bit of background information about our organization. We were founded in 1937, so we have a long history in our community. We have our main office in Poughkeepsie, and there's a picture of our Gothic mansion. And we also have a satellite office in Middletown in Orange County. We focus on providing funding, community investment into 40 some odd programs under the auspices of health, education, financial stability. We have essential items that we provide through our essential item program. These may be hygiene items, housewares, clothing, different items that are particularly helpful to those that are unhoused or survivors. We also provide professional development and capacity training to hundreds of nonprofits in our community, send volunteers out to do service work or our national days of service. And again, under health, education, financial stability, we have a strong food security team, focusing on SNAP outreach, community outreach, and again, increasing food security in our community. We have our 211 Human Service Referral Hotline, which is a human service helpline available 24/7, 365 in our community and yours. So please do look up 211. It's available in over 200 languages, and it's a great tool in reducing stigma, and that folks can call for any sort of services, be it mental health or otherwise. And in general, through these different programs and services and more, we're providing capacity to hundreds of local nonprofits. So this is a snapshot of our work, just looking at the different impact and community investment that we're having. Last year, we made a community investment through our programs and services of over $11 million of value. We've helped a number of individuals, over 200,000 in different ways, from our 211 Human Service Helpline to free Lyft rides in the community, to crisis intervention programs, to our volunteer programs, to emergency food and shelter, and so much more. And the total, of course, is 214,000 folks that were impacted by United Way programs and services. That's 1 in 4 in our community. So going into a little bit of the specific project that I'm here to talk about, our Stigma Reduction Project, and again, very grateful to Office of Mental Health. We focused around 21-day equity challenges, and we started our equity work very earnestly after the killing of George Floyd in 2020. Prior to that, we always made sure it was a strong focus of ours, but we really wanted to make sure that diversity, equity, and inclusion was top of mind in every single thing that we did. So we put together an internal committee, and we meet every other week to provide internal and external programming to our community at large, as well as our organization. And I'm going to speak a little bit more about what that looks like in just a moment. In addition to some other pieces of this project, we provided nonprofit professional development training opportunities throughout the year with a number of expert speakers. We also hosted a community conversation around food security, and of course, always thinking about those linkages within mental health and reducing stigma. And of course, that's sort of our overall focus through this project, and that work continues. Our audience consists of community members, folks like you that are out there today listening, different service providers, folks in our BIPOC population, and hard to reach populations. So this is a look at our most recent 21-day equity challenge. So we have continued that work afterwards. Each year we have a 21-day equity challenge for Martin Luther King Day and Juneteenth, a racial equity challenge. For Martin Luther King Day, this was our most recent one. And each day we tackle different topics, everyone that signs up, and we had 300 participants most recently. They receive a link to an article, video, and a podcast around a particularly themed topic. So it could be any of the topics related to racial equity, gender equity, ableism, ageism, mental health, any of the sort of different barriers that folks are experiencing. We also have a strong focus on LGBTQIA as well. So most recently, we launched January 15th of 2024 and finished it up on February 12th. So every day, folks were receiving about an hour of diversity, equity, inclusion training. And I've been looking at our survey results because we always want to make sure we're measuring that data. And, you know, one direct quote was that this challenge had made the person that participated a better person. So I think that sort of narrative, that sort of testimonial really speaks for itself. Taking a look at some of our prior equity challenges, we also like to make sure that we're tying it into really relevant topics that folks are looking at, that they may be experiencing some sort of barrier as a result. We're trying to really focus on education awareness and promoting diversity, equity, inclusion topics so that this really does help reduce stigma in our community and increases mental health protective barriers. So you can see some of the artwork of the different days that we talked about. Can look at some of the focus being around LGBTQIA, gender equity, racial equity, ageism, ableism, and what have you. Data collection, of course, is a very important aspect of all projects. And so in terms of putting together equity challenges, we had a very data-focused strategy. So first, we looked through our community level surveys because we made sure that we surveyed a post prior to this partnership. And then we were able to see what sort of focus areas folks would like to learn more about that were past participants. We also had a lot of anecdotal data and outside of the survey data. My team and I sit on about 12 different community coalitions. So we're very focused on having our ear to the ground in the community and seeing what the emerging needs are and, seeing what the different struggles folks are facing and how we can be part of that positive change. And then, of course, like I said, our internal diversity, equity, inclusion committee gets together every other week and reviews what our strategy and our events and activities might be going forward. Through this particular project, we also implemented a pre and a post survey, so we're able to increase our data collection and again, make sure that we received a lot of that anecdotal data as well. That was a very key area. And then just a quick aside, we also have our diversity, equity, inclusion committee also hosts a monthly internal lunch and learn opportunity. So every month, our internal staff are looking at the different aspects of diversity, equity, inclusion. We recently hosted a Black History Month lunch and learn. We'll have a Women's History Month lunch and learn for March, and then for April, neurodivergence lunch and learn. So again, we're just looking at the different kinds of stigma folks are experiencing, trying to educate our community, trying to make everybody feel that this process, this challenge has made them a better person, and then we can really create that community level change and reduce those stigmas. So we had a very strong impact. Different deliverables included the completion of the MLK Day Equity Challenge, as well as our Juneteenth Equity Challenge, our DEI United seminar, which is part of our professional development series, the North Stars are fundraising, and our community conversation around food insecurity. And those numbers are just how many folks were participating. So you can see with our diversity, equity, inclusion work, that's about 700 people right there. Through our measurement tools, we have our constant contact list, so we're able to see how many folks we're initially providing that outreach to about our different activities. We have our community listservs through those 12 some on community coalitions that we participate in. We have our different social media followers, so we also share out all of these resources each day on social media. So we have even more engagement than we're able to. We want to make sure that we're providing that secure measurement, but we know that our sort of mobilization in the community is even stronger and broader than we're aware of. For example, one high school club, the Anti-Racist Club, went ahead and sent out the equity challenge that they participated in to every single person in that high school, and we found out that later. So again, we know that the reach is really broad. There's even ways that we're not capturing it, so we know we're making that really strong community impact. Continue to do that direct outreach, and we're able to track the unique participants. But again, like I said, there are some reach and impact that is also happening, which is so exciting. And of course, we have our pre and post activity surveys. So, of course, lessons learned is always a key part of any campaign, any sort of initiative that you take on. So we wanted to make sure that we're able to look and devise any lessons learned so that we can increase and improve our equity challenges going forward. We wanted to make sure that everybody could participate virtually, just being cognizant of the digital divide. That's something we always like to keep in mind. Thinking too, people that have that lived experience with topics, particularly marginalized communities, BIPOC folks, may be reticent to participate in some of the difficult topics they may be triggering. And then, of course, just thinking about how we can make sure that these hard to reach populations can participate, given they might, have being if they're a low income person, they may have challenges related to transportation, childcare access, multiple jobs, and whatnot. So some recommendations for all of you. The first one I want to talk about is that you can steal and borrow our research. So I have the link in there at the bottom. We have over 200 vetted community resources related to topics of diversity, equity, inclusion that you're just welcome to go on our website. Please do give us credit, but please still borrow our research. We love to share and we love for folks to become better humans in all communities. So I really do hope you take me up on that. I will be sharing my contact information at the end, so you can certainly go ahead and contact me as well if you have any questions or if you want to just chit chat about how you may be able to implement this particular program in your community. So obviously making diversity, equity, inclusion a permanent part of your organizational programming, both internal and external. And like I said about the internal lunch and learns, that was also an incredible opportunity for us because I've had a number of staff since we instituted these lunch and learns a few years ago that come up to me frequently and tell me that having these safe spaces and these opportunities to reflect has made them feel more included, and that they are able to participate and voice the different struggles they may be experiencing. And it makes us all feel more included and welcome. Of course, utilizing the different community outreach mechanisms that you may have in your community. Of course, we look at our constant contact, our social media, those community conversations we are having, those community coalitions, but I'm sure in your communities, you may have additional channels. So that sort of brings me to my next point. I know all of our communities are unique and that you certainly have resources available already, so please leverage them as an opportunity. I think sometimes people get scared about taking on new initiatives because who's going to do it, right? We already wear so many hats. So for us, the internal committee was great. It was made up of individuals from every department, trying to make sure that wasn't too much additional work, but making sure that the people that were selected and wanted to participate were really engaged in the work and willing to hunker down and do a lot of research to make the community a better place. So making sure those roles are identified, making sure you have your note taker, your agendas, and what have you, and then divvying up the research for the equity challenges themselves. Of course, it's always great if you are able to get a diversity, equity, inclusion intern or AmeriCorps member. We have those as well. But again, it can be done with the capacity you already have. Measurement, of course, you can make sure that you are hitting your outcomes and goals and make increases and revisions and revise your strategy for the years to come. Considering your alignment of your priorities along with your funding proposals. So for example, we always talk about our diversity, equity, inclusion work in the different proposals that we submit for funding, because we're very proud of this work. It's so important. It's so critical. And so please let everyone know the work that you're doing. We want all of us to be invested and included in diversity, equity, inclusion work to make our sector stronger and a better place to work for everybody. And, just telling your story, what does it look like? If you could be a one-person shop on this call, or you could be a 100-person organization. You all have different stories. You all have different lived experiences. And this is an opportunity for you to really share some of that experience that your organization and the folks that make up your organization have. And of course, there is that link with those 200 resources that you can borrow or steal. This is my contact information. And like I said, I'm happy to field calls, emails. I love to talk about this work. I love it when other organizations, are able to take part in it. I recently presented at our United Way New York State conference on this work, so that United Ways and all New York State communities could leverage this work. So I'm just thrilled to have the opportunity to share all of this with you today. Please don't be a stranger. Call me, email me anytime. I'd love to talk about this program in your community. And I just want to thank you so much for your time. I'm really appreciative. It has been wonderful having this opportunity today to present to all of you. And I thank you for all the work that you are doing in your communities. Thank you again. Please don't hesitate to reach out, and I hope you have a wonderful day.